Good evening, Doc. My name is Muhammad Auffa Ghali, a student number of 3008. Now I'm here to make a video explanation about the things I've learned during the dentition and occlusion growth block, especially the BMS3, that covers the core principles of dentistry, which comprises of tooth anatomy, eruption patterns, numbering system, and occlusion. These are the fundamentals that can be used during our clinical practice to provide precision in diagnostic, treatment, and patient care. Uh, Starting off, I will be talking about the tooth anatomy. So basically, tooth anatomy is the cornerstone of all dental procedures because each tooth has its own shape, and the shape follows the function of the teeth. For example, the incisors is used to slice food, canines is used to tear food, and the molars is used to grind the food. And these principles is called as the form follows function that can be used as a guide to restore the teeth, identifying the tooth anomalies, and sharpening the clinical decision making. And moving on, I'll be talking about the tooth development and function. So humans develop two sets of teeth. The first set of teeth is called as the primary teeth, which comprises of 20 baby teeth that start to erupt from the age of 6 months until 2.5 years. And the other sets of teeth is the permanent teeth that comprises of 32 permanent teeth, and it's starting to erupt from the age of 6 years until adulthood, including the wisdom teeth. And for the tooth formation process, it is called as odontogenesis, that starts from the dental lamina and progresses through cell differentiation and until eruption. So next one is the tooth numbering system. It's used for clear communication in dentistry, and there are several of tooth numbering system. The first system is called as the universal system, where we number the permanent teeth using number 1 until 32, and the second one is the Palmer notation, which we name the quadrant of each teeth quadrant using numbers of or letters. And lastly, the FDI numbering system, it's 2-digit, combining the quadrant and tooth position. And next, the eruption sequence. For the primary teeth, the first teeth to erupt is the lower centrals, and it ends with the second molars. And for permanent teeth, the first teeth to erupt is the first molars and ends with second or third molar. And for the teeth orientation terms, there are several terminology that we use to in our teeth. The first one is mesial. It's to describe the teeth, whether it's toward the midline or not. And for the distal, it's something to describe a position where it is away from the midline. And next is the labial or buccal, which means the outer surfaces, while lingual or palatal means inner surfaces. And for the occlusal, it's the chewing surfaces, while the incisal is the biting edge. And for the tooth structure and support, a tooth comprises of the crown, neck, and root with layers of enamel, dentin, and pulp. And for the supporting structures of each tooth, there are something that are called as periodontal ligament, alveolar bone, and gingiva, which anchor the teeth. And the proper contact between adjacent teeth prevents misalignment and foot impaction. And the occlusion essentials, there's a thing that is called centric occlusion, which means the optimal jaw tooth alignment. And the last one is the angles classification, which diagnoses by relationship that classified into several classes. For class 1, it's normal, class 2 overjet, and class 3 underbite. Thank you for listening.